Nearly 700,000 people suffer a stroke each year. The good news is the vast majority survive.
But getting to a hospital quickly is vital for a good outcome. Welcome Cathy Greene, stroke coordinator for Frye Regional Medical Center. Cathy, welcome to Charlotte today. Thanks so much for being here.
Thank you for having me.
Okay, first off, what are the signs and symptoms of a stroke?
We use the acronym FAST. It's an easy way for most people to recognize what's going on. F standing for face, a sudden onset of facial drooping. A, arm drift. You want to see if they have weakness, sudden weakness on one side or the other. S stands for speech. They'll have a sudden garbled speech or inability to respond to something that you've asked them. And T stands for time. Time is of the essence when you start experiencing these symptoms and you want to get to a hospital quickly. Okay. Call 911 and activate the EMS system to help you.
So at any point during the fast, is that when I call 911?
Exactly. The sooner you get someone to you to help you, because there is a time frame that you're wanting to stay under for treatment. Some of the treatment options have a specific time frame that you need to be evaluated and for the treatment to be effective.
Cathy, let's talk about who's at risk and risk factors.
Sure. There are modifiable risk factors and there are those that you say that are unmodifiable. The things that you can change and help with are inactivity. If you don't exercise daily, get out and walk. Obesity, high blood pressure, take your blood pressure medicines as prescribed. Atrial fibrillation, that's when the heart just at the top of the heart just quivers. You have a possibility of a blood clot forming in the heart that will go out to the lungs or to the brain. So you want to take your medicines as prescribed and keep that heart rate under control. Those are things you can change and help with. Things you can't change are your age, your gender. Sex, those big things you cannot change. Those are things that you're born with, your genetics. Men, 55-year-old African-American men have the highest incident of stroke.
Wow. Now, Frye has a primary stroke center. Can you tell us more about it?
Yes, a primary stroke center is a specific designation by Joint Commission. And Joint Commission is a nonprofit agency that certifies and accredits health organizations that show processes that implement improvement of care and taking care of the stroke patient. And we are one of those centers.
Cathy, can you talk about treatment that's available for stroke patients?
Sure. Like I said, time is of the essence. You want to know what we call time zero, when the symptoms started. One of the things that we can do to help with those people is TPA. It's called the clot buster, if you've ever heard of that, because there are two types of stroke. One is an ischemic stroke, which is a clot that is sitting in an artery. The other is a hemorrhagic stroke. It's bleeding on the brain, which is one that is pretty detrimental, and not many people survive from that one. But the TPA can go directly to the source. It can get that clot busted up, and we get blood flow back to the brain as fast as possible.
Cathy Greene, great information today. Fast, we can all remember that. Really good.
Yes,
and control what you can control.
Exactly. Yeah. Get out and move.
We appreciate your time today. For more information, call Frye Regional Medical Center. The number is 828-315-3391. Again, 828-315-3391.